sugar, LFT, KFT, more hours than your urine routine. It is the parameter amongst all parameters. And without much ado, let's begin the talk, which I named ABC of CBC. So first, you can't begin a talk on CBC without addressing this gentleman. Anybody? Yeah. So he's Sir Wallace Coulter, who along with his brother Joseph Coulter gave us the Coulter principle, on which all modern analyzers, hematology analyzers are based. So without him, we won't be, taking this lecture out here today. So in most modern analyzers, there is a technology what we call as fluorescent flow cytometry. What happens here is that there is a laser beam throwing light at 633 nanometer. There is a forward scatter which shows cell volume. There is a side scatter that shows internal structure or the granularity of the cell. And there is a side fluorescence which is giving us the RNA and DNA information of the cell. So basically what it is telling us that the more immature the cell line, the more is the RNA and DNA content. So based on these three informations, we have something which we call as SFQ1, our analyzer. We can call it with VCS or some other name on some other analyzer. What it is doing is basically these three information, it is tabulating into a cube. On the x-axis is the side scatter or the granularity. On the y-axis is the fluorescence or the RNA DNA content. And on the z-axis is the forward scatter or the cell size. So based on these three information, it is clustering different cell types into different cell lines. You look at this green dots here, these are basically nothing but your lymphocytes. You can see that they are on the extreme left of the side scatter, which means that they have the least granularity. And on the forward scatter, they are kind of placed a little bit in the mid segment with this pink cell line just ahead of it. So this pink cell line is the monocyte. So obviously monocytes are bigger than lymphocytes, hence ahead of the green area. But both of them have very little granularity. So on the left side of the side scatter. This area in the middle is the area of the neutrophil and basophil, which have kind of more granularity than the previous cell line. And this area on the right extreme is the eosinophil, which has the maximum granularity. This small tiny green dots above the monocytes, these small dots, these are the HFCs, or on some analyzers they are also called as the HFLCs, high fluorescence cells or high fluorescence lymphocytic cells. These are nothing but your old fashioned downy cells, virocytes, transformed lymphocytes, call it as you may. These are primarily increased in most viral infections, also increased in certain lymphoid malignancies. This area above